One thing I like to say to everybody is that Emeriti is something that personally I feel like I needed to hear about a lot of times before I understood it. So don't feel bad if this is your third, fourth time and you're just starting to grasp it, because that's what it took for me. If it's longer than that, then I don't know what to tell you. Yeah, no, not really.
I still don't understand this, so it's all right.
So anyway, we'll go ahead and just let Joe take over and talk about Emeriti. Joe Manini from Emeriti, and Joe's been going around to all the schools in the area and running back and forth, and he's a busy guy.
Yeah.
So Joe, take it away.
I'm running on 3 hours sleep, so if I nod off while I'm talking, just nudge me a little bit. So thanks, Carrie. Like Carrie said, my name is Joe Manini. I'm the Director of Marketing at Emeriti, and as part of the program, the Emeriti program, we come out to campuses that belong to the consortium each year to give you an update on what's changing with the program and what effects healthcare reform may have, and how Medicare integrates with that. We're doing something a little different this year. Typically, our presentations are an hour and a half long for individuals that are just starting out in their career, kind of letting them know why they should save. Folks that are more towards the end of their career thinking about retiring, which is what this session is for. And then also for people that are actually retired, to let them know what changes are occurring in 2012 for the insurance plans. So this session, as I mentioned, is geared more towards those folks that are later stage thinking about retirement and how the Emeriti program coordinates with that. So now, I'm trying to see, remember, I think I recognize you. Have all of you folks sat in on any, at least one session?
One.
Okay, all right, so the program in general hasn't changed how we deliver the benefits to participants, but there has been a big change in the partnership of the program and who we work with to deliver the benefits of the Emeriti program. So just in general, SPU is going to provide this benefit for you in retirement. They have been making contributions into your account since 2006, I believe, yes, 2006. So anyone aged 35 and over who is benefit eligible has been receiving contributions into a tax advantage savings account. And you will continue to receive those contributions for up to 25 years if you choose to work that long. If not, they'll cease when you terminate employment. The contributions this year by the university total $900 a year. So those dollars are put into, and it's done on a monthly basis, put into your account on a tax advantage basis. So you're going to have dollars building up and accumulating for you in retirement that you can use towards retiree health expenses, including qualified medical expenses, as well as to pay for insurance premiums. And what the program also does is provides access to guaranteed issue group health insurance on a national basis. So wherever you retire, whether it's in the Seattle area or Portland, Maine, Portland, Oregon, or anywhere in between, you'll have access to guaranteed issue group health insurance in retirement. And again, as part of our commitment to communicating with you and educating you, we come out each year and do these workshops and keep you up to date on what's happening. The biggest change in the Emeriti program itself is when we launched the program in 2005, Fidelity was our record keeper for assets accumulation, investment management, and trust administration. And then a subsidiary of Fidelity, Aclaris, did all of the QMEs, or the qualified medical expense reimbursements. We've migrated away from Fidelity, and that will be effective January 1st. And we've split those functions with a couple of different organizations. And the record-keeping accumulation is now going to be administered by TIA Prep. So all of the dollars that are going into these accounts and accumulating on a tax advantage basis for you will be record kept by TIA Prep. They'll do all of the trust administration as well as the investment management. So in the past you had Fidelity and the Life Cycle Freedom Funds and the Money Market Fund. You will now, as of January 1st, have TIA Prep with very similar funds. So there'll be the life cycle funds that are similar to what was offered through Fidelity, and you'll also have a money market fund, and that will all start effective January 1st. Okay. So essentially what's going to happen, and we'll touch on it a little bit more later, any funds that you have in your account as of the end of this year, actually January or December 29th, the dollars are going to migrate into the TIA Prep funds. And there'll be what we call a blackout period where you're not going to be able to move around any funds until the latest January 15th. So your funds will move over into the TIA Prep account from the Fidelity account that you currently have. Starting in the second quarter of January of 2012, you'll actually have some additional funds that you'll be able to invest in, both proprietary funds, in other words, TIA Prep funds, as well as non-proprietary funds, so funds from other organizations. That'll happen in the second quarter of 2012. And we're now partnering with Sabbath. And Sabbath is an organization out of Philadelphia. They've been around for a little over 40 years, and they are a benefits consulting firm working with both active and retiree healthcare benefits. And they are going to do the disbursement record keeping. So in other words, when it comes time to actually retire and pay your insurance premiums, Sabbath will be doing all of the record keeping for paying the insurance premiums through the trust accounts that are associated with the Emeriti program, as well as the qualified reimbursement benefit portion of the program. So any reimbursement benefits that you submit, Sabbath will be adjudicating those claims. And they're going to be doing it both on a manual claims process where you'll be able to send in, just like you do today, a manual form, paper form. You'll also be able to send in a fax for the reimbursement process. And then in the second quarter, or late first quarter of 2012, we're also going to be providing you with access to a debit card. So you'll be able to use this debit card at point of purchase to reimburse yourself back for qualified medical expenses. The insurance offerings, nothing has changed on that side. Aetna will again offer all of the insurance offerings through the program on a national basis. Again, guaranteed issue, group health insurance, and if you were in an institution that was domiciled in Minnesota, Health Partners would actually be providing those benefits. And if anybody has any questions at all.
What's the Minnesota? Health Partners is just in Minnesota?
Yeah, so if you were in an institution that was located in Minnesota,
all right.
Health
so
Partners.
Our only choice is Aetna.
Correct. Right, exactly. Yeah. So it really doesn't pertain to you. So just to give you an idea why it's important to have dollars built up in these trust accounts for you in retirement, as well as to think about making contributions on your own to start saving for retiree health care expenses. A lot of times when folks retire, they figure Medicare is going to pay all of their expenses in retirement. That would be nice if it was the case, but if not, Medicare currently pays about 64% of your medical expenses in retirement. Private insurance picks up about another 11%, so that's the plans that are associated with this program. And then out-of-pocket expenses, actually out of your pocket, co-pay, deductible, Medicare Part B premium, total about another 14%. Yes?
So the private insurance, that's like the supplemental insurance?
Correct.
Or something like that?
Right. Yep, exactly.
Is that basically what Aetna pays? Is this what you're giving us? Is that
Correct.
picture?
Right, exactly. So there was a study done last year at the retirement research at Boston College early in 2010. And they took a look at a couple retiring in 2010 at age 65 and calculated what money they would need to have put away available for medical expenses in retirement. And as you can see, if there was no nursing home care, it would be roughly $200,000 that folks would need to have set aside in retirement for medical expenses. And if there was some nursing home care expenses involved, that number would be over $250,000. So it's quite a substantial amount of money that you're going to be spending on retiree health expenses in retirement. If you're lucky enough to pay your home off in retirement, roughly about a third of all of your expenses are going to be medically related. So it's probably the number one largest expense that you'll have in retirement. So if you've got time to put away additional dollars in retirement, you really want to think about doing that, especially on a tax advantage basis through the Emeriti program. Medicare, when you actually retire, you turn 65, and you've enrolled in Medicare Parts A and B. I'll just give you a highlight of how Medicare works real quickly, because I can spend an hour just on Medicare benefits and how they work. Just as a quick primer, Medicare, the AECBs of Medicare is what we call them. Medicare Part A is your hospitalization coverage. Medicare Part B is your medical coverage. So that is really when you go to the doctor's office or if you have any lab visits, that would fall under Medicare Part A. Medicare Part B. Medicare Part A does not have any additional premium associated with it when you retire. You've kind of been paying for that through your FICA taxes during your working years, so there's no additional premiums associated with that. Medicare Part B, you will need to enroll in when you do turn 65 to participate in any of these insurance offerings. There is a premium associated with that, and it just came out a couple of days ago that monthly premium for 2012 will be $99.90. So essentially $100 a month for your Medicare Part B premium, which you will need to enroll in. So A covers your hospital, B covers medical. Part C is a little different. It's called the Medicare Advantage plan, or Part C. This is really where you turn over your Medicare Part A and Part B portions to a private carrier, and they become the primary payer for your medical expenses. So if you were to choose a Medicare Part C or Medicare Advantage plan, that carrier, in this case we obviously use Aetna, that carrier would become the primary payer and Medicare would no longer be in the picture. Okay?
Is that what Aetna is? Is this a C?
We offer an option. We have a menu of options to choose from medical and drugs and a dental plan. And one of the options that we offer from the medical plan here is a Medicare Advantage, or the PPO plan. So this particular option is this Medicare Advantage plan, where you're assigning your Medicare Part A and Part B rates over to Aetna, and they would then become the primary payer. Right? So K and L are not available. The traditional choice is, and that's our richest medical plan, and we'll talk about that in a little bit and how that coordinates with Medicare. So A is your hospital, B is your doctors or medical, C is that Advantage plan where you're assigning your rights over, and then Part D is actually the prescription drug coverage. Okay, and the way that works is that's not through Medicare. Medicare approves private insurers to participate in approved Medicare Part D plans, so prescription drug plans. So you would be going through a private insurer for your prescription drug coverage. And the plans that we offer through the Emeriti program and Aetna are all Medicare Part D prescription drug approved. So you don't need to go outside of the program to pick up a Medicare Part D plan. Now, the way the Emeriti program developed and evolved and started out back in the 2000 timeframe was through some research by a couple of academics, Ken and Linda Kuhl, through a generous grant from the Mellon Foundation. And they went across the country and did some research with retirees and folks thinking about retiring. And these items that are listed here are ones that folks really wanted to see in the plan design of the medical offerings through the Emeriti program. So obviously all of these plans that we offer are built on the foundation of Medicare. They're all guaranteed issue group health insurance plans. So when you decide to retire, regardless of your health situation, you can't be turned down. So they're all guaranteed issue group coverage. Another big benefit of the program and what folks wanted to see was annual choice. So where some institutions may offer one health insurance plan and one prescription drug plan at retirement, we offer a menu of options. And again, there are, through the program, there are 4 medical plans, 2 of which are approved in the state of Washington, 3 prescription drug plans, and a dental plan. So when you retire, you can, if you're relatively healthy and you're only going to see the doctor maybe once a year for a physical, and you take maybe 1 or 2 maintenance drugs, you can take the lower medical plan and the lower prescription drug plan, and then as your needs change from year to year during the open enrollment period, which is currently underway now, you can move from plan to plan. And again, that's regardless of health. So, you know, even if you come down with a serious illness, you can move into a richer medical plan and not have to worry about being denied coverage for that plan. So you can move from plan to plan. And another big benefit is these plans are all portable. As I mentioned before, regardless of where you retire, you can move into any one of these plans. The plans will all look the same as if you retired here in Seattle or in Portland, Maine. They would all look the same. The coverages would be the same. The traditional choice plan has no network for coverage, so you can see whichever physician or facility that you choose, as long as they accept Medicare. Yeah, as long as they accept they accept Medicare.
I'm considering retiring to a place where the hospital here doesn't take Aetna. So how?
Yeah, well, there's
that separately, I guess.
And there's a distinction between active health insurance, where there may be a network involved, as opposed to post-65 Medicare supplemental plans.
Okay.
So the traditional choice plan that we offer.
That's a supplemental.
Right. That's it's called a 100% COB or coordination of benefit plan.
Okay.
As long as the physician or facility accepts Medicare, they'll take that. So there's no network involved.
Okay.
Right. Yeah. So there is a distinction between active health insurance and retiree health insurance.
In that particular situation, then the PPO wouldn't work because they're not.
The network may be different from what the active plan is.
Oh, okay.
So there is a network with the PPO plan, but you do have coverage in and out of network. It's just your right. The deductibles and the co-insurance is a little different.
Yeah.
Right. Exactly. So again, the portable plans, regardless of where you live, you've got a menu of options to choose from that you can move in and out of each year during the open enrollment period. All the plans offer catastrophic protection, which means once you've reached the maximum out-of-pocket limit, the plan will pay 100% of covered Medicare expenses, so you won't need to worry about going into your pension plan, your 403B savings for additional medical coverage, because these plans will cover that. So you've got catastrophic protection, prescription drug coverage. As I mentioned, there's 3 options available: a high, mid, and low plan, all Medicare Part D approved, so you don't need to go outside of the program again. Foreign urgent emergency care. Medicare, if you're traveling, say overseas, and you have a medical emergency, Medicare doesn't cover any of that. There's no coverage for emergency care overseas. Some of the plans that we offer do provide additional emergency coverage when you're traveling overseas. And some of the plans offer additional preventive care coverage above and beyond what Medicare would cover. So these are some of the foundations and fundamentals that individuals really wanted to see built into the design of the plans that we offer. So how do you access your Medicare Medicare and health insurance? Again, to participate, these are post-65 plans, which means that you have to be at least age 65. And to participate in these plans, you have to meet SBU's retirement eligibility, which in this case is age 60 with 7 years of service, or age 65 with 5 years of service. So as long as you've met that criteria, then you can participate in the post-65 insurance plans that are offered through the Emeriti program. So assuming that you've met that retirement eligibility, these plans, again, as I mentioned, are all post-65, so you have to be at least 65. So if you work to 70, that's fine. You have to be at least age 65 and retired, and you have to enroll in both Medicare Parts A and B to participate in the insurance offering. So who can actually use the insurance? Obviously you as the retiree can use it. If you have a spouse, your spouse can use the coverage. If your spouse happens to be under the age of 65, we do offer a pre-65 insurance option that is available. Domestic partner coverage is not available. Dependent children before the age of majority, so before the age of 19 if they're not in higher education, or 24 if they are. Aetna actually follows the guidelines for the new Healthcare Reform Act and allows individuals or your children to stay on the plan up till age 26. So if you're retired and fortunate enough to have a 17-year-old still at home, they can stay on your plan until age 26. And permanently disabled children, if they are disabled prior to the age of majority, they can stay on the insurance plan for as long as they choose. And just kind of a little note here that for post-65 coverage, if you are covering a spouse or other dependent, that spouse would need to take the same combination of medical and prescription drug coverage that you choose. So you both need to be in the same plan. So I mentioned before, and again, this presentation is one we do on a national basis, and it varies by state depending on availability of plans. So in the state of Washington, there's a couple of plans that are currently not available. But the first medical plan is a Medicare coordinated plan. It's called 100% COB traditional choice plan. And it's the richest plan that we offer through the program. Essentially, it has a $200 deductible. And once you've met that deductible, the plan pretty much pays 100% of Medicare covered expenses. So it's a very rich plan. The next two plans are Medicare supplement plans, K and L. They're currently not available in the state of Washington. Aetna is continuing to work with the Department of Insurance in the state of Washington towards moving to get approval of those plans. But for 2012, they will not be available in the state of Washington. If you retire outside the state of Washington, those plans would be available. So it's just not available within the state of Washington. And then the last plan that's available is that Medicare. Yes?
Do you have a listing on your website or someplace that would tell what states that would be available?
Yeah, there's 5 states that are not available. Washington is one of them, Maryland, New Hampshire, Vermont, and I believe it's Delaware. Yeah, but it would be on the list. Yeah, it would be on the website. Yeah. So as long as you retired in one of the 45 states where it was available, you could choose that medical option. So the last one is the Medicare Advantage plan, and that's Part C plan, where you assign your rights, your Medicare Parts A and B over to Aetna in this case, and they become the primary payer, and there's in and out of network service. So prescription drug plans, and again, each of you should have that description of the plans that gives you a little more detail of them. But we offer 3 prescription drug plans, a high, mid, and low plan. The low plan is pretty much like a standard Medicare Part D plan. It's a little enhanced, but it's more like a standard Part D with a $320 deductible, with no coverage through the coverage gap, or that donut hole that you've probably heard about. And it has a closed formulary, which is a little more restricted on the drugs that are available to choose from. The mid-level plan moves to an open formulary, so it's a little more robust formulary and drugs to choose from. It also goes to a $100 deductible as opposed to a $300 deductible. And once you've reached that coverage gap or donut hole, there's actually coverage for generic brand drugs. So you do have some coverage in the donut hole, and then once you get through that, that plan pays 95% of your expenses, as does the low plan. The RX High plan is our richest medical plan, and again, that's an open formulary, $100 deductible, and when you do reach, if you do reach the coverage gap or donut hole, you have full coverage through the donut hole. So you have coverage for generic brand name drugs, preferred brand name drugs, and non-preferred drugs. So if you're someone who takes a large amount of prescription medication, then maybe something that you would consider. And the RX Low plan, again, as I mentioned before, if you're someone that's only on 1 or 2 maintenance drugs, that may be the plan to choose. And when you're actually due, at the point where you're going to be retiring, you basically get a call our service center to let them know which combination you want to choose. If you have any questions at all, if you have your drugs handy, they should be able to help you out and let you know which ones may be the best. Yeah.
Is there a website where you can go to find out if your drugs are covered? And stuff
yes,
like
you can
that?
go to the Emeriti website. There's links there that you can get the formularies to find out which drugs are on which formulary. Yeah, so it'll either be the standard formulary or the open formulary. Yes.
On this co-insurance retail, 15, 30, 40%, and co-insurance MOD, what does that mean?
MOD is for mail order delivery.
Okay.
So if you use the MOD or mail order delivery, you get an additional 5% discount.
So then, let's just go to the mail order delivery. What does the 10% mean? What does that 10% mean?
So, so this is, the first number is for co-insurance, means what co-insurance is your portion of what you pay of what the cost of the drug is. And the first one would be generic. The next one would be a preferred brand and non-preferred brand. And you would be able to find that right on the formulary as to where that drug.
Okay, so you would pay 10% of the cost. It's not like a 10 or 15 or 20.
Right, it's not a
You're actually
co-pay,
paying
it's
the
a
cost.
percentage, right? Which, in the case of generic drugs, typically works out better because generic drugs are pretty inexpensive.
Mm-hmm.
So, if you had to pay a $15 copay for, you usually would come ahead of the game with the co-insurance and generic drugs.
Okay. So then what you're saying is that coverage would continue through the donut hole
Correct.
until you spent $4,700.
$700, right?
And then it would be 100%?
For that plan, it would pay 100%, right, exactly. Yeah, that's our richest plan. So once you did, you would have full coverage through the donut hole, or coverage gap. And then once you've gone beyond that, and met the true out-of-pocket expenses, the plan would pay 100%.
Is the true out-of-pocket expenses apply to the mid-plan? When would the 95% take a hold?
Once you've reached that, what we call true.
That 4700.
Yep.
Okay.
Yep. Yeah. Once you've reached that, then you're back in what we call a catastrophic protection. And the richest plan, the high plan would pay 100%, and the other 2 plans would pay 95%.
These percentages are, I assume, in this case, situation, Aetna or whoever's doing this has negotiated the special pharmacy pricing stuff, so it's not the retail pricing of the drug?
Right, it's the Aetna. Well, there's retail, and then if you use the mail order,
Yeah.
it's a negotiated rate. So
Even now, if you buy at the retail pharmacy, there's some kind of special pricing the insurance company gets.
well, there's a couple of discounts, and I don't believe it's on this presentation, but that will be available for 2012. If you reach the coverage gap or the donut hole,
This isn't a,
oh, just
there's nothing to do with that. It's just that, you know, if you walk into the drugstore and ask for an expensive drug, and I can't name one, if you're Joe off the street, it's $500. But if the insurance company, you pay maybe your copay, and you get the thing from the insurance
Right, they have
company,
negotiated
they only
price.
pay $300.
right.
And so, you know, there's a negotiated price.
Right,
Is that
exactly.
same kind of thing?
Yes,
that here?
yes,
Okay.
yes. Yep.
What were you going to say about in the donut hole? Because I think I've heard something about brand name drugs
Yeah,
are supposed to be 50%.
In the donut hole, there's two discounts. Generic drug coverage, the government is actually offering a 14% discount if you're in the donut hole for generic coverage. So you would pay 86% of the cost of the drug, the generic drug. And then for brand name drugs in the donut hole, pharmaceutical companies are offering, if they're participating, and most of them are, not all of them, but most of them are offering a 50% discount on brand name drugs. So if you did hit the donut hole, you would get the 50% discount at point of purchase. And then in our traditional, or high plan, it was a preferred brand name drug, the co-insurance is 30%. So for an example, if it was a $100 drug, automatically you get that 50% discount. So it's now down to $50, and then you would pay your 30% co-insurance, so it's $15, right? So you get the benefit of the pharmaceutical discount as well as the co-insurance coverage in the donut hole.
And the low plan would also have that 50%?
Yes.
Okay, so that's something that the government has.
Right, it would have the 50% if the drug is on the formulary. Yes.
Is that effective yet, or is that something that's coming with future years of healthcare reform?
It is effective now.
Okay.
50% was effective in 2011. In 2011, generic was 92% that you would pay, so that was an 8% discount. So that was increased to 14%. Right.
Okay.
Yeah. So what do you need to do when you're thinking about retiring? You need to meet the eligibility requirements, enroll Medicare Parts A and B, be at least age 65. Then you would call our service center, 866, the Emeriti number, and figure out which medical plan you would want from the two that are available here in the state of Washington. Select a prescription drug plan that you feel would be most suitable for your needs, and then think about adding a dental plan. So dental can always be added to the combination of medical and prescription drug coverage. Okay. Yes?
Do you have to take the dental at the beginning of your retirement, or you can add it or drop it as
Good question. A couple of things with the dental plan. You don't need to take it initially. You can choose that at any point down the road. Once you do choose the dental plan, if you opt back out, you can't go back in. So you can't go in and out. So you don't have to take it right away, but once you do take it, if you opt out of it again,
You're gone.
yeah. And there is a waiting period for major services of 12 months if you don't have existing coverage. So if you're coming from a dental plan, moving into that dental plan, that 12-month period is waiting. But if you don't have dental coverage, there is a 12-month period, waiting period for major services.
What is the dollar amount that gets you into the donut hole now? Is it the money that you spent or the value of the drugs that you?
It's the money that you spent and what the insurance carrier has paid. And that's a little over, I think it's on there somewhere, $2,700 or so. Then it'll put you into the donut hole.
But it is the
Right, it's the combined amount of what the insurance carrier has paid and what you've paid. Now, to get out of the donut hole, it's that $4,700 consists of just what you paid out of pocket. That's where the true out-of-pocket expenses. So it doesn't include what the...
So with these discounts, you probably wouldn't get out of it.
It depends on your utilization, yeah. Everybody's going to be different.
So the insurance carrier's payments plus your payments must equal 27?
Yeah, I can get that exact number for you. All right, and then the $4,700 to get out of the donut hole is just what's come out of your pocket. What Emeriti also has done is said, essentially, if you're relatively healthy and you want to conserve those dollars that the university's been putting into this account, and if you've been putting any money into this account, you can do that by taking a standalone RX plan only. So you don't need to take the dental or the medical plan initially. So this would get you enrolled in the plan, and then each year during an open enrollment, as your medical needs change, you can move into a medical plan. And you can also take the dental plan with the standalone RX plan as well. Again, the reimbursement benefit, that works kind of like a flex spending account for retirees. So essentially, if you have dollars in this account, and I'm going to speed up a little here. If you have dollars in this account, you can actually pay yourself back or be reimbursed for qualified medical expenses through this account. And again, it's either by sending it in via the mail or sending it in through fax to SAVITs. So if you're already retired or submitting claims will continue to be submitted to SAVITs, or will start being submitted to SAVITs as of January 1st, 2012, and again, either by mail or fax. And then that debit card that we talked about will be available starting sometime in the spring of 2012 to reimburse yourself back for qualified medical expenses through the use of a debit card at point of purchase. This is just a condensed list of some of the items that you can be reimbursed back for through the reimbursement benefit. Your Medicare premiums, as I mentioned before, those premiums are $99.90 for 2012. You can actually send those in to be reimbursed through that reimbursement benefit. Any deductibles, co-insurance, or co-pays that maybe Medicare or the insurance plans don't pay, you can reimburse yourself or be reimbursed for those. Over-the-counter medication, starting in 2011, you actually need a prescription for over-the-counter medication to qualify for reimbursement. Medical equipment, long-term care insurance, other post-65 insurance premiums. When you actually do retire at age 65, you're not wedded to the plans that we offer through Emeriti. You can go outside of the program and choose a plan. So if you looked at our plans and maybe you looked at an AARP plan and decided you wanted to choose the AARP plan, you could do that. And then you would use the reimbursement benefit of the program, so the dollars that are in that trust account, you would pay your AARP premium and submit a reimbursement form and pay yourself back for the premiums for the AARP plan. One caveat there is when you do retire at 65, Aetna wants you whether you're healthy or sick, because they really are trying to avoid adverse selection. So you need to make a determination then. If you choose to go outside of the program and take an AARP plan, you can't come back in to the insurance offering. The only way that you could do that is maybe you're 67, retired, and your spouse is 63, and you're still covered under a spouse's plan, and then your spouse retires at 65 and loses coverage. That's considered a qualifying life event, and then based on that, you could come back into the program because it wasn't a choice of yours. So who can use the reimbursement benefit? Basically, it's the same list of individuals. Domestic partner coverage is not available, but what we're adding here is dependent relatives. So maybe you're taking care of an elderly parent or in-law, and they qualify under the IRS guidelines of dependent relative. So they live in your household and they're dependent upon you for at least 50% of their economic well-being. Any qualified medical expense that he or she incurs, you can actually be reimbursed through this account, through the reimbursement benefit. The funds are going to go again into the TA Prep life cycle funds as well as the money market funds. Again, as I mentioned before, if you have any dollars in these accounts, they're going to be transferred over at the end of 2011, and starting in 2012, they'll be available in the TA Prep accounts. There'll be that blackout period that I mentioned from the 29th of December through no later than the 15th of January. You'll get a statement at the end of 2011, beginning of 2012 from Fidelity that'll essentially show a zero balance and the funds transferred out. And then you'll get a statement from TA Prep showing what your new balance is, essentially what the funds transferred in would be or will be for 2012. Fees essentially are staying the same for the program. The Emeriti fee is $5 for both active and retirees. TA Prep is 67 cents for both active and retirees. Savits is $1 a month while you're working, and it moves to $6 a month in retirement because that's when most of the heavy lifting and transactions for insurance premium, reconciliation, and qualified medical expenses are occurring. In retirement, SPU is picking up the Emeriti fee for both active and retirees. So while you're working, the Emeriti fee is picked up by the university, and in retirement, the Emeriti fee is also picked up by the university. Different ways to get more information. I think we've probably touched on a lot of these. The service center, as I mentioned before, the toll-free number is staying the same. Any questions you have about investments or insurance, the service center is staffed by TA Prep, Savits, and specially trained individuals in the Emeriti program. Enrollment kits you'll receive in the mail prior to turning 65. Workshops, we come out each year. I think this is my 5th year doing workshops here at the university. The website we've recently enhanced, and it's very helpful. There's a wealth of information on there. I would recommend going on there and taking a look at getting some good information. If you're interested in finding out what the premiums are anywhere in the country for the plans that we offer, there's a tools and calculator tab you can click on, put in a zip code, and it'll tell you what the rates are. Coming in 2012, we're going to have a new, what we call dashboard, that's being compiled by Savits, and it'll give you, basically it's a snapshot of what your accounts will look like. It'll show you what your balances are in your account, what insurance plans are available to you, and if you've had any qualified medical expense claims, it'll show you the history as well as any outstanding claims. Lifestyle communications, through this new partnership, we're able to really target more precise communications to participants right from date of hire until you retire and beyond. And then in the past, you had received an annual statement from Fidelity regarding your accounts. Starting next year, in January, you're going to be receiving quarterly statements, both from Fidelity and from Savits, to give you your account history. So it will give you a little more up-to-date information. Okay. Kind of went through that last part quick. I know we're on a time crunch here. Any additional questions?
So in terms of the transfer, it's going to be mapped. So like if you're in a Fidelity money market, it'll go to a TIA?
Right, depending on, whatever life cycle fund or money market you are in, it will map over to a similar life cycle or the money market fund that's available through TA Prep. And then after that 15th, you will be able to, so if you've been making, I don't know if you've been been making voluntary contribution, and you've specifically earmarked where you want your dollars to go, and not just went into the default investment, which is the age appropriate, assuming you're going to retire at age 65, you will need to call the service center and up that again and let them know what your options are going to be, or what your plan is, right? But otherwise it will map, any existing dollars will map into similar funds from Fidelity to Telegraph, right? And then if you do choose to make voluntary contributions for the first 6 months, roughly, of 2012, it will be through payroll deductions. You will need to see Carrie and make those planned elections.
No, just call the 1-866 Emeriti.
That's
Oh, no,
actually
it's changing.
Yes, that's
Okay,
actually
got it,
changing.
got it.
Yeah, so
It is
before you
changing.
had an option to
That's
do
right.
both. As of January, you're going to get to see more Carrie as you
Yippee skippy.
yeah, want to make contributions through payroll deductions. You can also make contributions through what we call ACH transfer, direct transfer from your bank checking or savings account. That feature will not be available until the second half of 2012, okay? And you'll be able to make either lump sum contributions, or if you wanted to establish a reoccurring transaction, once a month I want to put $50 in this account, out of my checking account, you can do that, but that won't be available until the second half of 2012.
What is the advantage of doing that, just so you can pay all your medical bills through this system?
You can pay all the medical bills through the system, and the dollars that you put in would go in on an after-tax basis, but any earnings that you have would be tax-free.
Okay.
And when they come out tax-free.
Is there any way to move pre-tax money in some other retirement thing?
No. Good question, but no.
And the other thing is, though I don't think any of us have this kind of money, there is no limit on the amount that you can put into the Emeriti. You know, it's going to be used for healthcare costs. Whatever amount you had, if you came into a huge sum of money, you could sock it away in there. Whereas with our retirement plans, there's a maximum where you're capped.
And if you die with a balance in the Emeriti?
Good question.
You die with the balance in the Emeriti, depending on, the dollars are handled differently if it's employer contributions or employee contributions. If you should die with a balance, which is probably unlikely, but if you did, the employee, so you passed away, all those dependents that we went through, your spouse, your eligible dependents, they've all passed away, or you don't have any. Any employer dollars that are remaining in the account would come back to SBU to offset future costs of the program. If you were to put voluntary contributions into these accounts and you had no eligible dependents, those dollars would actually come back to the community here at SBU, and your colleagues would all share equally in the balance of your account, assuming that they have also made voluntary contributions. So if I had $1,000 left in my account, voluntary contribution, and all three of you had made voluntary contributions, you would all share equally in the money that I had in my account.
So it would move from your voluntary account
To yours, right, exactly. Exactly. Yeah. Good question. Any other questions?
Matt, you're good for questions.
Say like if you want to pay your long-term care insurance with it, and I assume once you retire, you probably just have that taken out of your checking account or something.
Yeah.
Or could you sign it up to take it out of your Emeriti?
I don't think it automatically would come out of the Emeriti.
Yeah, the only automatic payments would be for insurance premiums through
And that's with you.
right through this program. You can always use the reimbursement benefit to be paid back.
Yeah.
And then you would what?
You would fill out
You
the
have to
form.
show your premium notice or
Right,
monthly
right.
thing and show.
Right, a bill, you have to show a bill and send that in with either manually send it in through the mail, or you can actually fax it in. Right.
So very much
But
like a
lot of
flexible
these
spending account.
Are going to be automatic withdrawals out of your checking, so, but you'd need some evidence that this has been coming out.
Right.
Yeah, they probably send you a statement, and if they don't, you could always call and ask for one from the insurance company.
As well as your Medicare B premiums, you could.
Correct. Right, exactly. Yeah, and that's $100 a month just for yourself.
Mm-hmm.
So, yeah, that, like I said, the odds of having additional money left in that account are slim.
Okay, you've been running the program for what, 10 years now?
6 years.
6 years.
Yeah, 2005, July 2005, we initially launched the program.
The Maritime Bank.
Correct. Yeah.
Great.
Well,
Well,
thanks.
thank you.
Thank you. Thank you. Thank you.
And of course, if we have any questions, we can go to the 1-866 Emeriti number, or you guys can contact me and we'll see
I
who
have
will
a
get.
question for you.
Oh boy. I'm